and welcome to today's autism spectrum disorder video. There are many conditions associated with Asperger's and high-functioning autism. In this video, we will look at obsessive-compulsive disorder. Obsessive-compulsive disorder is an anxiety disorder, characterized by intrusive thoughts that create apprehension, fear, or worry, by repetitive behaviors aimed at reducing the associated anxiety, or by a combination of such obsessions and compulsions. Symptoms of the disorder include excessive washing or cleaning, repeated checking, extreme hoarding, preoccupation with sexual, violent or religious thoughts, relationship-related obsessions, aversion to particular numbers, and nervous rituals, such as opening and closing a door a certain number of times before entering or leaving a room. These symptoms can be time-consuming, and often cause severe emotional distress in the child with Asperger's and high-functioning autism. Despite the illogical behavior, obsessive-compulsive disorder is sometimes associated with above-average intelligence. Children with this disorder commonly share personality traits such as high attention to detail, avoiding taking risks, careful planning, exaggerated sense of responsibility, and a tendency to take a lot of time when making decisions. Some children with obsessive-compulsive disorder perform compulsive rituals because they feel they have to, while other children act compulsively in order to alleviate the anxiety that stems from particular obsessive thoughts. The child might feel that these actions somehow either will prevent a dreaded event from occurring, or will push the event from their thoughts. In any case, the child's reasoning is so distorted that it results in significant distress. Excessive skin picking, hair plucking, and nail biting are all on the obsessive-compulsive spectrum. Children with obsessive-compulsive disorder are aware that their thoughts and behavior are not rational, but they feel bound to comply with them in order to avoid feelings of panic or dread. Some common compulsions include counting specific things, such as footsteps, in specific ways, for instance, by intervals of 2, and doing other repetitive actions, often with unusual sensitivity to numbers or patterns. Children with obsessive-compulsive disorder might repeatedly wash their hands or clear their throats. They may make sure certain items are in a straight line. They may repeatedly check to make sure that all their toys are in a particular order before leaving the bedroom. They might constantly organize in a certain way. They often turn lights on and off. They often keep doors closed at all times. They might touch things a certain number of times before exiting a room. They walk in a certain routine way, like only stepping on a certain color of tile, or walking on their tiptoes. Or they have a routine for using stairs, such as always finishing a flight on the same foot. According to professionals, behavioral therapy, cognitive behavioral treatment, and medications should be regarded as first-line treatments for obsessive-compulsive disorder. Therapeutic treatment may be effective in reducing ritual behaviors of obsessive-compulsive disorder for children and adolescents with Asperger's and high-functioning autism. Family involvement, in the form of behavioral observations and reports, is a key component to the success of such treatments. A parent's intervention also provides positive reinforcement for a child who exhibits appropriate behaviors, as alternatives to compulsive responses. After 1 or 2 years of therapy, in which a child learns the nature of his obsession, and acquires strategies for coping, that child may acquire a larger circle of friends, exhibit less shyness, and become less self-critical. Although the causes of obsessive-compulsive disorder in Asperger's children range from brain abnormalities to psychological preoccupations, life stress, such as bullying, and other traumatic events, may also contribute to cases of obsessive-compulsive disorder, so acknowledging these stressors can play a role in treatment. A coping technique called thought stopping can help reduce or eliminate obsessive thoughts. In this technique, whenever a child has an obsessive thought, he's encouraged to shout, "Stop." He says this while in mid-thought to interrupt the obsession. A variation of this technique involves the child counting loudly, backward from 10, and then thinking of a pleasant scene. As I stated earlier, there are many conditions associated with Asperger's and high-functioning autism. In this video, we have looked specifically at obsessive-compulsive disorder and its treatment. If you have any questions about how obsessive-compulsive disorder may be affecting your child, feel free to email your questions to the address below. Someone will respond to your question within 24 hours. Thanks for watching.